Okay, well, let's go ahead and get started. It's just about 12:31. I know everyone's time is very valuable, so let's go ahead and begin. Um, Good afternoon, everybody. As I mentioned, my name is Lloyd Morris. I am your host today for the webinar. My partner Cindy will be joining me in just a few minutes, and she'll take us through a live presentation in Lytec of exactly how insurance eligibility verification works. And at the end of the webinar, we will be glad to take any questions that you may have. I do want to thank you for taking time out of your busy schedules to join us. We've got a really good agenda for you today, and from the large number of people that are in attendance here, I can tell that this is a topic that's of interest to a lot of people. So let's get started. But before we do, I just want to cover a few real quick housekeeping items. First, this webinar is being recorded, and it will be available probably not today, but but by the end of the day tomorrow on the AVS Medical blog page, and you see a link to it there. So it's avsmedical.com/blog. You can download a copy of the slides and a copy of the audio and video there as well. If any of you still have your GoToWebinar control panel up on the screen and it's blocking your view, you can click that little red and white arrow there. That will minimize it. And then lastly, I just want to point out at the end of the webinar, you can click that little hand icon, and that will indicate to us that you'd like us to unmute your phone line, which we can do, and you can ask a question. Or if you prefer, you can type a question into that little chat window, and we can answer the question live. So Cindy, just move to the next slide there if you would. Okay. So our goal for today's webinar is to show you one of the most powerful features in Lytec, which is the ability to easily and automatically verify a patient's insurance eligibility. But most importantly, how to verify it without having to make a phone call or to go to individual insurance companies' websites and manually key in that information. And this really kind of all goes back to something that we hear all the time from our users, and that is that they know there's things in their Lytec software that will make their jobs easier, make their lives easier, and will increase the practice's cash flow, reduce denials, and reduce billing errors in general. They just want to learn how to use the software better or learn more new things in the software. So this is one of those great tools that you find in Lytec that a lot of people don't know about. So that's our goal for today. And with that, I am going to stop talking and turn things over to Cindy. And Cindy, go ahead and take it away and tell us about this great opportunity, this great feature in Lytec.
Well, thank you, Lloyd, and good afternoon to everybody. Happy Wednesday. In speaking about insurance eligibility, I think there are some main points to remember as to why it's so important to get the policy information from each one of your patients as they're arriving into the office. The idea is you want to make sure that you know that their insurance is still active, and also that they're giving you as much information about it in case there's a secondary or if there's been a slight change to their policy. Also, you want to make sure that you're going to collect the correct copay amount. Sometimes the patient's card may be out of date or their policy has changed slightly. So if you get an insurance eligibility verification report for that day, you'll know exactly what that copay should be, and you'll collect the correct amount while the patient's there in the office to be seen. Obviously, if you get the correct insurance up front, you're going to minimize the number of rejected claims that you're going to have to work later. So with the cooperation of the front desk staff, you can really help out the billing follow-up for most of the claims that are going to be filed for the practice. And as you know, it takes so much more time after you've already filed a claim to go research it, try to get the correct information, try to contact the patient to update their information and refile a claim. So you've really reduced the amount of work on the back end if you do it correctly up front. Stop treating patients for free. So often, if the insurance is not correctly given to the practice when the patient arrives, after all efforts to file a claim have been extended and then there's still money outstanding, it's sometimes very tough to find that patient to get paid, and you end up treating patients for free. There are several different methods to verify patient insurance, and of course you can use the old way of calling up each payer by telephone, and some offices do that. They have someone in the office dedicated to making those phone calls and verifying insurance for patients. You can also get user login and password information for all of your major payers, and then spend time every day logging into the payer website, entering your information, and then keying in all of the policy information, name, date of birth, for the patients that are going to be seen to try and validate whether or not their insurance is active. You could also log into your clearinghouse. So whatever clearinghouse you do use, most of them have a portal that you can log into with your clearinghouse credentials, and then again input each of the patient's individual policy data to verify their insurance. But as you all know, that could be very time intensive. It's going to take away a lot of staff time trying to follow up on those. So the idea is if you can automate the process or automate the majority of the eligibility inquiries by putting it into your Lytec and letting Lytec do the work on the patient's information ahead of time, you'll be way ahead of the game. So in order to automate the process, Lytec has the ability to add an insurance eligibility check based on who you have listed on the schedule. In a moment, I'll open up my Lytec for you to take a look at that and show you how that works. You could also check eligibility on patients one by one by simply going into Lytec, opening their demographics screen, and then clicking on a button. The software will go out automatically, check the eligibility, and give you a report, and that's called real-time eligibility verification. You can schedule eligibilities to be done as many days ahead of the visit as you would like, and I'll show you how you do that in your Lytec. And also, if you have scheduled those eligibility checks to be done, there are little flags that appear on the schedule screen showing you the results of that verification. The software will give you a detailed result. It's a 271 report, and it'll show you all that, and it'll save it within the patient's record. And it'll also save a history of how many times you've requested that eligibility result and on what dates and what was the result of each one of those. So it really can help you going forward, because if you do have a problem with getting a claim processed, let's say the payer says that the patient was not under policy on the date of service, you actually have an eligibility result that proves, in fact, that you did check it and that the patient was insured on that date of service. Okay, so I'm going to go ahead and open up my Lytec and show you where all these different features are located within the software. First of all, any patient record has a button over on the right-hand side under Patient and then Eligibility Verification that you can go ahead and click on. And in practice, as you're entering a new patient or a patient arrives for their first visit in the office, let's say, and you're entering this information, you could just go ahead and click F9 on your keyboard or go ahead and select this option here, and it will open up the results of your eligibility. What you would do in a live situation, and I've got demo patients here, they're not real people, so we don't have real information, but you would click on the button that says Verify, and the software will go out and within a couple of seconds bring you back that 271 report. The report does vary by payer. So once you start using it, you'll kind of get used to what the reports look like. But in this demo report, if you notice, down at the bottom we've got results and we've got details. The details will refer to the time and date stamp when you requested the report and what was what the results can't speak, consisted of. But the results on the front screen are what you really want to pay attention to. And the kind of information you would want to know is the coverage active as of today? And also, what copayment do you need to collect at the time of service? So if we go down here a little bit, we've got a section in here for our primary care physician. This particular one has during office hours and after hours, the copay is slightly different. But that information is very important for you to know, and you can go ahead and say it's a $15 copay, and then you can add that into your insurance information so that the front desk will know that that needs to be collected on each visit. And you can go ahead and verify that you are collecting the correct copay. Now, I mentioned also that we can do this kind of verification from the schedule. So I'm going to go ahead and open up the Lytec schedule. And here's some sample patients for today. In order to check anyone's eligibility from the schedule, you would just simply right-click on the patient appointment and then go down to eligibility verification. Again, that's an F9. And you would see the exact same report that we just showed on the patient demographic screen. On my demo system here, you'll notice that the second column in, kind of trying to point on it with my mouse, has a little flag. And if the system, if this were a real live eligibility verification that's been already set up, you would see a flag appearing next to every single appointment on my schedule. And that flag, if it's green, it means that the insurance was verified and that it is active. And you can go ahead and look at those details to view further information, including the copay, deductible, things like that. If the insurance is not active, there'll be a big red X. And if there's any question about the insurance, for example, it tried to check that patient, but you didn't have the setup complete, or that particular payer does not have, and I'll show you that in a second, the setup completed to check for that payer, you'll see a yellow flag in that column. And the idea of that is so that as the front desk is reviewing the calendar for the day, they can quickly glance down the list of all patients who will be arriving and see which ones have green flags so they don't have to do any follow-up. If there is a red X or a yellow flag, they would then want to take additional steps to verify the insurance eligibility by either asking the patient when they arrive to give them the card so they can double check what information they've put into the demographics, or maybe at this point you would want to call the payer and find out why you can't verify the insurance. Okay, in order to schedule eligibility to be done, there is an option here. You would find it under Tools, Task Scheduler, and then Schedule Eligibility. And I have one that I've already set up here, but we'll open it up to the Edit screen. You would give it a name and a starting date and decide what time of day you'd like it to run. This particular process runs in the background. You may want to schedule it at a time where you do not have backups scheduled, so it just gets a chance to go through its whole routine. And in this case, I've scheduled 7 p.m. I'd like it to check every day, and I'd like it to check one day before the patient's appointment. You can really change that to anything you want. If you'd like to check, 2 days ahead of time and give your staff a chance to follow up on those that are not eligible, you can certainly do that. The schedule options I've got here that it's 2 days prior to an appointment date. And I've said don't verify the patient eligibility more than once in 5 days. That's not really such a big deal. You can, what it's saying is if the patient was seen here on Monday, I don't need you to verify the insurance again for a couple of days. But you can certainly make that whatever you would like. You can verify both primary and secondary insurance. So I've got both clicked on mine. And once you schedule that task, well, it will automatically run, and if it does not run, you'll get a message on your screen when you log in under that username. It happens to be my user, and that will pop up when you enter Lytec and say, I was unable to complete the eligibility the night before. Okay, simple setup steps that you need to go through in order to get going with eligibility. First of all, I did not mention earlier on that this service is available through the Relay Health Clearinghouse. So for those of you that already use Relay Health, and a lot of our clients do, you already have that capability. We just need to make sure that we enhance your setup in Lytec, and you can go ahead and start using it. For those of you that do not have Relay Health, you could go ahead and switch your clearinghouse to Relay if you're interested in this feature. And we'll be happy to talk about that, after the webinar is complete. Steps that you need to take are set up your insurance carrier, and let's go ahead and pick one. We'll go with First Healthcare. And you would go in here and select your receiver, and you would have one receiver set up for Relay eligibility, and then you would put in the correct eligibility payer ID for that payer. And there is a little lookup button in the software which will launch the complete list of all of the eligibility payers, and you would search for them and select, it would be 87043. And once you add those to each of the payers that you want for eligibility, the software will know which code to use when looking up eligibility for that particular payer. Another place that you have to make a slight change is in your provider settings. So you want to look up your provider, and then make sure over here on the right-hand side of the box, there's a little check mark that says Allow Eligibility Verification. And that absolutely has to be turned on in order to allow that payer's provider IDs to be used in the eligibility verification check. The last thing that needs to be set up is something called revenue management. If you're using Relay Health for claims, you've already got this set up, and then we would just assist you in turning it on for eligibility. We just need to go ahead and do it's a very short setup for us to add that, and then you're able to use the eligibility features in your Lytec. Okay, one great way to find out how you're doing with eligibility is once you've set up a system, to make sure that the office and the staff are verifying insurance eligibility for your patients, you would want to run an appointment eligibility analysis frequently, especially when you get your program first going. You want to make sure that the staff is doing a good job of checking each patient. That report can be found in this analysis area. And I'm going to run one for today. We don't have any live eligibilities, but just to show you what the report looks like. Okay. In this case, it's going to list out each patient's name and then whether or not the eligibility was checked. Now, if you're doing this process manually, you could still use this report, print it out once a day, and then have someone note, the person who's checking on your eligibility, note on each line whether or not it was performed. If you do choose to go ahead and get the automated checking through Relay Health, then the software would say yes. It would give you the details. So this report could be printed at the beginning of the day so that Lytec and Relay Health has gone ahead and given you all the information you need here. You would print out this report, and you would just be looking for patients that did not have the details listed under each one. And then again, you can focus on trying to get the correct insurance information for those particular patients when they arrive that day. In order to set goals and hopefully celebrate your success in this program, I really feel there's 4 main things you want to consider. First, you want to make sure that the front desk is totally involved in this process, and that every time they greet a patient, they're going to verify their insurance. Patients will get used to verifying their insurance at every appointment. If they don't have their insurance card, you could always print out their patient statistics out of Lytec and ask them to verify that information. I also have some Lytec practices that when they print out a paper super bill, they've got a super bill that has the information at the top that includes the patient's insurance, name, and policy, and who the guarantor is. And then they ask the patient to verify that that information is correct at every appointment. You want to go ahead and utilize the report that I just showed you so that it's very front and center at the beginning of each day that your intention as an office manager or as a practice administrator is to get to that 100% success rate, as close as you possibly can. If you're starting at 0, maybe 25%, 50% is a good goal to try to utilize that report, and then try to set a goal for your team, the front desk team, or whoever's answering the phone, as much information as you can possibly get so that you can make sure all of your patients are verified and that you're assisting as much as possible your billing department to get the information and get the claims paid. Okay, Lloyd, I'd like to go ahead and open up if anyone has some questions regarding the presentation or anything about eligibility.
Sure, absolutely.
Just a reminder.
Yeah, absolutely. So
in order to
I'm sorry.
Go ahead,
I
Lloyd.
didn't mean to cut you off there, but sure, yeah, absolutely. We can take questions now. We're still got plenty of time here. So again, on your GoToWebinar control panel there, you see an image of it. If it's minimized, you can click it, maximize it on your screen. You can click that little hand icon and we'll unmute your phone line, or if you just prefer to type a question in there, we'll see it and we can answer it out loud so everyone can hear the answer. So we'll just sit here for a few minutes and wait for some questions. And while we're waiting for the first one, oh, hang on, we've already got the first one. So here's a good question. The question is, are we responsible for setting up the insurance carriers?
Yes, you are responsible for setting them up. It is a pretty fast process. It's a one-time only. But yes, you would have to go ahead and, if you're referring to the codes that go into the insurance company setup, you do that. Also, when you do payer enrollment, that's when you would go into, in this case, it's Relay Health. There is the ability to request payers to give you these insurance eligibility reports. So it's usually something we do when you first enroll with the clearinghouse. When some payers like Medicare, Blue Cross Blue Shield still require you to fill out a document to send claims. They also do require a signature. It's online though. You don't have to do paper anymore, but an online signature to request eligibility reports. So there's 2 things that you have to think about as part of your responsibility.
Okay, great. Thank you. Cindy, what changes would need to be made in Revenue Manager? Is it quick enough that you can show us, or is it a little bit longer than that?
And what, I guess if that's in reference to someone that already has Relay Health, the only thing you need to do is set up your eligibility receiver. So right now, for those who have Revenue Manager, you've got if you're using Relay Health, or even most of the other clearinghouses, we're sending ANSI 5010 format. So that eligibility receiver, there's a little wizard when you set up a new one. So you'll just set it up for eligibility. And I do have instructions on that. So if it's someone who's interested in doing it on your own and you don't need our assistance, I'd be happy to send you the instructions. It's pretty short. It's like 2 pages to do.
Okay. Great.
So just send us an email or Lloyd, however. We're going to have a follow-up email after
Yeah,
the
you'll get a follow-up email after
webinar.
this with the, you're actually, I mentioned that this is all going to be on the blog, but you're actually going to get an email with a link you can click and download the recording and the slides. You won't have to go to the blog, although I would encourage you to go to the blog. Next question is, where can we find out more information about Relay Health? That will be in in that email that you'll get from us if you're not on Relay Health already, or we'll reach out to you. Next question is, can certain codes be verified through this process that are used to see if they require a prior authorization?
No, and I wish that that were the case. There is more extensive information available on some of the payers' websites, and that does not come in that 271 report that I mentioned. So basically, this process is verifying only that the patient is active, and it does have simple information like copay, what is their total deductible. It doesn't show you whether or not they need authorization for a certain procedure, unfortunately, and it also doesn't show you their up-to-the-minute deductible. Now, there is another utility available through Relay Health, which just came out, which lets you estimate how much a procedure would cost. And as part of that, I think it does also tell you whether an authorization is required. And I've got more information coming on that from Relay Health. It's called an estimate predictor, and it's very similar to if any of you have ever gone to for a dental procedure. They're very well known for doing that, where they collect the money right up front. They know what your co-insurance is, for example, and they'll do an estimate. They'll collect the patient's money up front, and then they'll say to you, if there's any money left, we'll send you a check in the mail. The dentists have become, I think, very good about collecting that. And this is going to help a lot of people who do medical procedures or do require authorization to estimate, what they need to get before the procedure is done. So we'll get more information out on that, I would say, within the next week.
Okay, great. Okay, our next question is a follow-up to the first question that we had. And the first question was about our users are responsible for setting up the insurance carriers. And the follow-up question to that was, are the codes the same ones that they submit electronic claims to?
That's a great question, and no, they are not the same. There are a few that are identical, like Aetna is the word Aetna, but Aetna is not the same as the, I believe it's 6300 code for Relay. So they are a different set of numbers, and unfortunately, I wish you could just copy them, but you cannot. You have to look them up.
And is that's something we can help them with if they have an issue in looking those up?
Absolutely. Yeah. The lookup button is, I'm bringing it back up on my screen here. It is right in the payer. Let's see. Go to. So this lookup window, eligibility payer ID, when you click that, it brings open that lookup, payer ID lookup.
Can you go back to that last screen, because you kind of clicked that pretty quickly. I don't know that anybody could see that.
Sure.
Yeah.
So you look up the insurance company itself, and on the second tab, the claims tab, you have an option here for the eligibility payer. And when you click that, down here, actually, you'd want to be on Relay Health. And under each one of these windows, under description, for example, I could start typing, whoever I want as my payer. This was First Healthcare.
I think you've got.
Here we go. So I don't have an eligibility payer for First Healthcare. That's a made-up insurance company here, but here are some that are listed. Medicaid or whatever. And over here on the right, you can sort these by type. Sometimes when I'm looking for Medicare or Medicaid payers, it makes it faster. So, for example, Pennsylvania Medicaid is PACAID is their eligibility code, and it is a different code than the clearinghouse uses for claims.
Okay, great. Our next question, I'm going to take offline, and Amber, I'll have somebody give you a call. Okay, she's actually setting it up as we're doing the webinar here, and she's getting an error message that the eligibility transaction set is not configured. I think that's probably just a setup thing, and we will give you we'll give you a call here shortly.
Yeah, I know where that is.
Okay. The next question, this is a good one. They're all good, but this one I'd like to know the answer to myself. Is there a way to pull contract year versus calendar year? And the scenario is that sometimes patients are only allowed a certain number of visits per year, but it doesn't specify contract or calendar year.
Yeah, that's not in that 271 report. That's a little bit more detailed than what you get, but that brings up again this estimator that Relay Health has made available, and you can go in there and it tells you everything. You can go in there, you can put in a procedure code. It'll tell you exactly what they're going to pay or how much you should collect. It has the contract start date. So you're right. If it's April 1st to March 31st contract versus January to December, all that information would be in there. So that's more information than we've ever been able to see, and that estimator is going to be a really powerful tool, I think.
Okay.
But this tool is really limited. Just are they eligible, and what's their copay and deductible?
Right. And I think you used a term there that maybe not everybody's familiar with, but it's what Lytec displays in the tool here is all the information that comes on what's known as the 271 form. So if we're just displaying exactly what the insurance company gives us, and that example is not part of what comes on a 271 form. So unfortunately, it doesn't display that. The next question, again, I think is sort of a one-off issue for Sarah. We'll give you a call as well. She's indicating that when she tries to look up her payer IDs, Lytec's freezing and kicking her out. So that just sounds like a service issue. We'll give you a call, Sarah, and take a look at that. Well, we've gone a little over, but we've got time for more questions if anybody has any. But right now, I don't have any other questions in the queue. Feel free to ask one if you like. Okay, hang on one second. I'm going to unmute the phone line here. David, your line is unmuted. Did you have a question?
Yes. I guess I'm going to need to call support. I'm having the same problem.
Okay.
I can bring up the 273 report, but it never loads into the window like I see here.
Okay.
With the eligibility results.
Okay. Well, I'll have one of the tech team give you a call right after they're probably going to take a 10 or 15-minute break, but they'll give you a call once we get done here. So I've got a list going here as well. So we'll make sure that that gets taken care of. All right, great. Thank you. Cindy, can you review the provider settings one more time?
Sure. The provider settings are no changes to the way that you have the provider set up as far as their provider ID goes. So here's a sample provider in my Lytec. You would leave everything the same except over here on this front screen under claim, you want to make sure you put a check mark, allow eligibility verification. Most of the time you would have your signature on file checked as well. And then just as a review, I'm going to click over to the provider IDs table. This is where all of your NPI and tax ID information is included. It does not change for claims and eligibility. So if you're already submitting successful claims you wouldn't change anything in this table, and that's it.
And Cindy, does this work for workman's compensation claims as well?
Workman's comp, unfortunately, no. It does not. As far as I know, there's no way to, other than knowing that the patient might be covered under workman's comp, they don't have electronic eligibility for workman's comp.
Okay, great.
Or not great.
Oh, yep. Sorry, not great. Thank you for the answer. Here's a good question. Do you have to apply these settings to each workstation?
No, you do not.
Okay.
It's a one-time only, and you can set this up from any workstation.
Okay, good. So you don't have to go to the server.
You don't have to be on your server,
okay.
right? You just set it up from one workstation, then everybody has it. But you just reminded me that Revenue Manager, however, has to be turned on at every workstation where you would like to do the instant verification. So let's say normally someone might be using Revenue Manager, that little module that talks to Relay Health or talks to the clearinghouse. Many times only the biller has that set up. When you're doing insurance verification and you want the front desk to be able to hit that F9 key and get an immediate answer, while the patient's there at the front desk, then Revenue Manager must be set up on those workstations.
And that's not a problem. That's just a simple, fairly install. And then
yeah, we do it all
okay.
day. So we'll be happy to do it.
And then I've got just again, I'll ask this question, but nobody in the audience asked it, but I'll ask it. Do we need to? Are there user security settings that need to be changed, access level settings that would need to be changed in order for somebody to do this?
No, but certainly if you do have staff that's set up where they don't have a lot of privileges, then yes, perhaps.
Okay.
But what I would do is go ahead and test it with your supervisor level access, make sure it works for you, and then if you go to one of your staff and theirs does not work, it will come up, and normally what happens is they go ahead to try to do F9 and it just doesn't work.
Mm-hmm. Okay.
It's grayed out. So if they right click, it'll be grayed out, and then you'll know that yes, you do need to change the security for your staff.
Okay. Great.
But make sure it's working first for the administrator level or supervisor level.
Okay. Thank you. Okay, Cindy, I don't see any other questions in the queue, and we got one here. Does the verification check give actual benefits or just copay deductible amounts?
It verifies by payer. I'm sorry, it varies by payer. Okay. So I've noticed that some of them only show copay deductible, and it's a very limited amount of information, but it's really up to the payer. Each one has their own report that comes out. So you'll see that some are more extensive.
Mm-hmm. Okay.
But they're not standardized across the payers. Most of them just have the general information available.
Yeah. Okay. Again, it's we're simply displaying what the payer gives, and it's
what they would normally give anyway.
Yeah.
Right.
It's basically
it's their normal report.
Right. Yeah. So if you went to their website or you called them, you would get the same information via Lytec as you did through the website.
That's true, but when you call them, they have more, if you have more questions, let's say, do I need an authorization for this,
mm-hmm.
or can you give me an authorization for this? Then when you call them, they give you more.
Okay.
But this report that you see in Lytec is the same information you would get if you logged on to the website.
Okay. All right.
Okay, well, thank you, everyone. for taking
Yes.
so much time about it, and we'll follow up with the email and more information on Relay Health if you're interested in
Yeah,
that.
and I think everybody, you have either our phone or our emails. If you didn't get a question in, or you think of one later, by all means, please reach out and contact us directly. And if you need help in getting this set up, we're happy to help you set that up as well. Oh, okay, you're welcome. I thought it was another question, but it's just a thank you. Thank you. We appreciate your time. We will be doing other webinars coming up. Don't quite know what the agenda for the next one is yet, but we're kind of committed to doing a lot of these, particularly this summer when it is a little bit slower. So keep an eye out in your email for announcements of other ones. Thanks again, everybody. Bye now.